Stakeholders in health and care sector have agreed to implement a new standard curriculum for the training of caregivers to elderly people in Nigeria. The stakeholders disclosed this to newsmen at the end of a 3-day engagement on the development of national benchmark statement and minimum standards and curriculum for training caregivers to older persons in Abuja. The stakeholders' engagement was organized by the National Senior Citizen Center (NSCC) in partnership with the Federal Ministry of Health, National Board for Technical Education (NBTE), UNFPA, and National Primary Healthcare Development Agency. The stakeholders expressed the need for relevant agencies, states and local governments to get involved in the project. Speaking at the event, the Director General, National Senior Citizen Center (NSCC), Dr. Omokaro, said the meeting was to build a consensus on the need to develop a national benchmark statement and a minimum standard curriculum for training different levels of caregivers. She therefore assured the gathering that the process of validating the draft document will commence in earnest.
We have engaged experts, multidisciplinary experts, gerontologists, geriatricians, ministries, departments and agencies that have statutory mandates in social and healthcare, NBTE for certification of skills. You have a Nursing and Midwifery Council, WHO, UNFPA, Geriatrics Association of Nigeria, to mention but a few, and also already existing care agencies. So for the past 3 days, we have brainstormed, first and foremost, on the challenges of aging in Nigeria, challenges of care provision, and of course, build consensus. And that's the communique that all the agencies sign, that there is need to develop a national benchmark statement and minimum standard in curricula for training different levels of caregivers, and also for standardization of care agencies and even certification of care agency operators in Nigeria. So what we are coming out here with is a draft benchmark statement and minimum standard in curricula for training these different levels of caregivers, and also certifying care agency operators. What this means is that we have to now move from here to validation. After we all have harmonized, everybody has signed the communique, and we have now integrated and harmonized the draft, the zero drafts. It means that we have to move to states, because if we say it's national, then we must have inputs. That is why what we have here is zero drafts. Not long from now, we are going to be embarking on validation exercises, so that we ensure that we have captured even the voices of stakeholders, consultative forum on aging, voices of older persons themselves, and then we have input from state departments and agencies who are in charge of older persons, social welfare departments, because this concerns everybody. So it is really an excitement for us in National Senior Citizen Center to have initiated this and to have been able strategically to bring in all the actors. We are hoping that by August, we are looking between now and August, we should finish the validation exercises, and then of course we now have a document. But in August, we are calling all the experts back and some more, because we now want to develop the standard guidelines and regulations as a policy document.
On this part, the Special Assistant to the President on Humanitarian Affairs, Mr. Musa Bungudu, said the project was critical and important to the welfare of older persons in Nigeria.
This is a very, very critical and important meeting where you have different stakeholders that are really professionals. Many of them are PhD holders, many of them are professors with extensive knowledge and experience in the area of the older persons or the elderly. Coming together to develop a training framework that will be used, in fact, that we never had I couldn't believe, in fact, yesterday, I couldn't believe the models for the training that was developed. We don't have it in Nigeria. It was just developed yesterday. It was, in fact, it's still being developed. Different states have been represented. We have universities represented. We have home cares represented. We have community-based cares for the elderly represented. I can assure you that the outcome of this meeting will actually lead to much more programming that are targeted to the old people.
Also, Mrs. Sule-Jiringho, the founder of the Center for Happy Elderly People, said the engagement afforded her the opportunity to understand new dynamics in caring for the elderly.
My expectation is that when I leave this place, we have been able to formalize all the training we have been given over the years. Now, with the existence of NSCC and with the curriculum development, a standard one, and other programs that took place here for the past 3 days, when we go back, we're going to use it, continue, make it a standard. That shows that we've officially been approved on, the training that we have been given over the years. So I am happy that, I participated in this. And I believe that other states will also stand as example.
Dr. Emmanuel Sundo, the administrator of Tender Loving Care, an NGO, expressed confidence in the ability of the center to achieve its target of formulating a unique standard procedure for managing the health and well-being of older persons in Nigeria.
We came here as stakeholders and experts to develop policies and procedures on how to manage the health of the elderly. What I'm going home with today is that I thank the DG for putting this symposium together, and we've achieved the purpose that is designed for us to come here, developing policies, procedures, benchmarks on how to manage the health of the elderly in Nigeria. That is our team, and that's what we accomplished here today.